And good afternoon, everyone. This is Jamie Freshy, and today's webinar topic is the Ombudsman Learning Collaborative to Protect Residents Against Nursing Facility-Initiated Discharge, with the subtopic Training, Education, and Data Collection and Analysis. I thank you all for joining. As I go along, if you have questions, you can go ahead and unmute yourself and feel free to ask your question at that time. Thank you. As you all know, I just wanted to kind of go over our areas of focus for the project very quickly. We're looking at training and advocacy strategies, receiving and responding to transfer and discharge notices, data collection, analysis, and use, collaboration with legal assistance providers and legal assistance developers, and systems advocacy. Specifically for today's discussion topics, we'll be looking at effective training for representatives of the office, licensing and surveying staff, facility staff, administrative law judges, and legal entities. We'll also look at effective consumer education and using data to improve Ombudsman advocacy, training, and education and policy. So our first topic will be project states training for representatives of the office. I have to say, as I was looking through a lot of the information that you've already sent to the Resource Center or on our monthly calls, this really was an area where it looked like you all were doing a really great job in terms of training for representatives of the office. So I put on this particular slide some examples of what different states are doing. So many of you are training your Ombudsman on residents' rights pertaining to discharge, training provided on federal and state regulations, and in Louisiana, they had a training on mock hearings, and I was hoping that Rosa could speak briefly about that particular session provided. And Rosa, you'll need to unmute your line.
Hey everybody, it's Rosa. So we had Eric Carlson from Justice and Agent come and do a little training for us. Our legal services developer, Jane Thomas, had happened to be talking to him, and he just happened to be in our neck of the woods, so he offered to do a little training for us. So we set something up, and he had a presentation. It was called Protecting Residents Against Eviction, and we kind of went through that, and that all went well. And then later on in the day, we had a little section that, from the evaluations, a lot of the ombudsman really liked. He did little vignettes. He had kind of asked for some volunteers ahead of time, and he gave everybody a little description of what would happen between either a resident and the administrator, or, you know, a family member and another administrator. Either way, it just ended up being really good. I do have one video, and I can send to you, Jamie, that it just ended up being informative but funny at the same time, and people could kind of get out of their seats a little bit, so that was really fun. And then at the end of the day, we did a little mock hearing, and we were also lucky enough to get a former administrative law judge to come and kind of give us the ins and outs of fair hearings for a little bit, and then Eric and Jane, our legal services developer, then they did a mock hearing. So it ended up going really well, and I wish we would have taped that, but we didn't end up taping it. But I think one thing I would recommend, that I don't know if NORC or us all together can maybe do a mock hearing script for it. Since we ended up doing it at the end of the day, Jane and Eric just kind of, you know, were going off the cuff. They just kind of made up a situation, and it ended up being a little bit longer than we thought, but then the ALJ was kind of putting a note. So it was very helpful, but I just think a script would be helpful for the next time people do a mock hearing. But honestly, I think the part, and the Ombudsman really liked that we did that, but I think the favorite part of his presentation was definitely the vignettes. We got the most comments about that. But I really like that he was able to come, and we really appreciate him for that, and the former ALJ, and we never will turn down someone coming to Louisiana to teach. So it was all very helpful, and I'll definitely send you that video, and you can try to send it out. It was just one. There was another one I wish I would have taped, but I'll definitely send it out so y'all can kind of see what I'm talking about.
Can you hear me?
Yes.
Okay, yeah.
Oh, there's
excellent, actually. Yeah, he actually had given me he actually had developed an involuntary discharge plan, a whole notice. He had given me that ahead of time. I think what took a little longer than Rose and I expected was we had asked the former ALJ to give us some ins and outs. So she took a little longer before we could get started. Then as we got started, she actually stopped us in the process and said, at this point, I would say, did you give the other side a copy of these two pieces that you want to introduce? And was there any objection to that? And she would tell, us what she would consider and what her process would be. Mm-hmm. And then we started actually, he made an opening statement, and then I was able to then make an opening statement. And then after he introduced his evidence and presented his evidence, I was actually able to cross-examine him. Now, that was a little scarier for some of the ombudsmen because it was much more legal, but they got the sense that this could be doable, or, how you do your homework, because he had done an excellent job of the presentation earlier about what's supposed to be in the record and what the law is. But the ALJ was excellent in stopping and showing what she does and how they can conduct the hearing. So all in all, I thought that the ombudsman really benefited from it. Some of them thought that was a really good part of it, but most of them really liked the vignettes, which were the role playing, where people actually did a complete role playing as to some sort of a discharge and a conversation you would have with the administrator, and then how to incorporate the regulations or the reasons for the discharge in that discussion with them. And that was really well done, and everybody thought that helped. I think I agree with Rosa. Everybody put that down as the most helpful thing that we had there.
Yeah.
Thank you both so much. And I agree. I think that kind of a training, that's the next best thing to actually attending a real hearing. So I think a lot of states would benefit from that. So Rosa, anything that you have from that training, we would certainly appreciate receiving. Thank you both. Some other points that were on the training piece of it is training based on information collected from the data points tracked, and we're going to talk about that a little bit more in the webinar. The next is advocacy strategies for ombudsmen before and during hearings from a legal perspective. And Margaret in Pennsylvania had an annual ombudsman conference and had somebody come in and speak just to that. And I wondered, Margaret, if you could give a brief explanation of what that training looked like.
Can you hear me okay?
Yep, we sure can.
Okay. Sorry, I was just having an issue here with my phone. So good afternoon. As Jamie said, the training was conducted at our annual state conference, and the presenter was Sam Brooks. He's an attorney with Community Legal Services in Philadelphia, and they're part of the Pennsylvania Legal Assistance Network of Title IIIB legal assistance providers here in the Commonwealth. The perspective from an attorney was incredibly educational for several reasons. As ombudsman, we have the heart, we have the passion for tackling injustice, and I think by this point we're all pretty well versed in the 6 reasons for involuntary discharge. But what was great about Sam's training is that it drilled down into response tactics. So strategies like here in Pennsylvania, a lot of the ombudsmen did not know that you could request that the hearing be done in person if the consumer is able to travel to a nearby location. And his emphasis was that the in-person hearings really humanize and personalize your case. Another example he gave that was referenced earlier is the ability to have witnesses there, and even up to and including subpoenaing witnesses who can attest to the residents' need to stay where they are and the harm that would be done if they were to be moved somewhere else. Another strategy or tactic that he discussed in detail was the component that the notice be written in a language which the resident can understand. And it had not occurred to me, and we had recent success in this area in appealing a discharge from one of the VA homes. That notice was written in long paragraphs in formal military style, and it was challenging to understand. And the commandant, who had been uninterested in our advocacy efforts to rework the letter, is now likely changing his mind. Another example he gave was educating the ALJs, the administrative law judges, ahead of time. And that's one of the reasons why we're working with our legal assistance developer now to develop a bench book for the ALJs. He also noted that evidence rules are lax in these hearings and that hearsay is usually admissible, and he encouraged us to consider some ways in which to use this to our advantage. Sadly, despite all of these strategies, he did emphasize that the burden of proof is on the residents. So at the end of the day, it's got to be all or nothing when we as ombudsmen go to bat for these folks.
Thank you, Margaret. And I believe you had sent us the materials from that particular session.
Yes, and I'm happy to resend that because there's some great slides and some things that I thought were really thought-provoking for us.
Very good. You don't need to resend. I believe we have those. So thank you very much.
Okay.
Other states are doing training from Legal Services and Legal Assistance Developer. Oklahoma had a training also for their ombudsman on how to successfully avert a transfer or discharge, and that also includes that he had a pre and post test. So Bill, I was hoping you could explain a little bit about your training on averting transfers and discharges. You'll have to unmute your phone. If you're talking, we can't hear you. Okay, well, we can come back to that or check in with Bill at another time on what he had conducted. I know it was for I believe their recertification training, and they're really focusing on averting transfers and discharges and hoping that they don't get to a hearing and get resolved ahead of time. So we'll put that on pause for now, and we will move forward. To Project States training for licensing and surveying staff. Several of you have distributed a flow chart indicating where and when transfer and discharge notices are to be sent to the Ombudsman program and important definitions along with that flow chart, and had sent it out to the facility administrators in every skilled and intermediate care facility. Also, some of you had suggested having one-on-one meetings to educate the licensing and surveying state staff about complaints and concerns received and tracked by the Ombudsman program. And again, we're going to speak to that in a little bit later on in the webinar. And finally, meeting with regional survey agency supervisors to discuss transfer and discharge received and tracked by the Ombudsman program. And Margaret actually had another really good example of meeting with the regional surveying team, and I hoped that, Margaret, you could share a little bit of that.
Sure. Thanks, Jamie. In Pennsylvania, the Department of Health has several regional field offices, and you know, it's a mixed bag in terms of our level of camaraderie in responsiveness from them. So there was recently a change in leadership at their Pittsburgh field office, and we thought it might be a good time to make an effort to try to break down the us versus them that historically our Allegheny County Ombudsman Office and the Pittsburgh field office have had. And, you know, I realize that a lot of times the challenges we face are because we have these constraints of confidentiality, but where there are opportunities for us to partner with other entities like Department of Health to share information, those are the kinds of things that we're always looking for. So we arranged for their 2 field office supervisors to come into the Allegheny Ombudsman office and meet, and we got donuts and coffee. And as it turns out, the two new office directors actually had been with the Department of Health for some time, and so some of the there are 8 people on the Allegheny Ombudsman team. And so it was really an opportunity to try to break down some of those walls of communication. And what we found was that despite the flow chart that we shared from Louisiana and modified for Pennsylvania use, despite that going out to all of the regional field offices and despite the state DOH office having an understanding of what we were doing pertaining to transfers and discharges and all of this, the supervisors had no idea. They had no idea that we were either tracking this, that our perspective from this was, you know, really looking at this as something that was trauma-inducing to the residents, and also you know, our ombudsman team got a chance to hear a little bit from their perspective on the kinds of complaints that they receive, the level of their workload. And the reason that I mentioned this is, you know, we've got a lot of great information, but in terms of how we can convey that in a compelling manner, that was something that was an incredible lesson learned for me. Because, you know, we learned that, for example, that field office used to have 27 complaint investigators, and now they're down to 16 surveyors. So, you know, they rotate on phone call complaints, their annual surveys that they're, you know, behind on, and their complaint-related surveys. And now we're trying to introduce this other component of, you know, when you go out, are you looking for all of these 6 elements? And so for me, the challenge was, how do we convey the importance of this work and what we're doing in the mix of all of these other complaints, and how do I get it to rise beyond just a paperwork concern or an administrative compliance issue, and really present it to them in terms of these are people's lives, there's trauma that's induced by moving them out of the home, when when the regulations are not adhered to, this is serious business. So it was really time well spent. We met for about 2 hours, and they shared with us after we asked them, what can we do in our messaging to you when we send you an email, when we send you what we're tracking? They had no idea that we had a whole list of nursing homes from whom we've never heard. And so they were actually eager to get that information. As far as how this translates out to how the Ombudsman Office can actually save them time in their survey process, I'll be sure to keep you updated. But it was a very well spent afternoon.
Thank you. Oops, I did not mean to go ahead and felt like I cut you off real short there. Margaret, thank you so much. I appreciate that. That is, like you said, excellent time spent. So moving forward to the project states training for facility staff. Examples such as residents' rights pertaining to transfer and discharge planning. The district has come up with a model discharge document that we have Marianne and Mark to discuss for you all today. So I think Marianne, you get to take the lead.
Yes, I briefly go over it. I hope you can hear me. In
Yes.
DC, basically use this model discharge and transfer plan is supposed to guide facilities, residents, and representatives throughout the whole discharge process. The DC law actually required that the regulatory agency develop this model plan to ensure that this assistance is provided to all residents being discharged from nursing homes. It's supposed to be more user-friendly than just trying to ensure that a list of regulations are followed. So, for example, the model discharge plan reiterates the requirement of advance notice of discharge and the requirement of notification to the resident of his or her appeal rights. You know, it also defines and provides the steps for the whole discharge planning process, such as ensuring that preference is given to the resident choice, that resident is given an opportunity to make at least 2 visits to alternative placements. And the plan also outlines what documentation and information needs to go with the resident to ensure continuity of services and requires a post-discharge plan. So it emphasizes that the resident can only move to a safe and secure environment where their healthcare needs can be met. So we should note that DC's regulatory agency didn't develop this plan, even though it was required to, until we forced them through a lawsuit in 2004. But then they did. And so while we've used it throughout the years, we're now in the midst of trying to update it to provide more details regarding what is not a safe and secure environment, such as homeless shelters, temporary moves to hospitals, and motels. And while we want to update this plan, it is still a useful tool that we can use when we're going through the discharge process. That's it in a nutshell.
Thank you, Marianne. Mark, did you have anything to add?
Nope.
Right. Very good. Thank you. And I'll be very anxious to see your revisions on that. We have the current discharge model, but like I said, I'll be really anxious to see what you all come up with on down the line. Another training session is to provide one-on-one information and assistance to facility staff about the transfer and discharge process, when and how to notify the Ombudsman program. Several of you are doing that. And again, a distribution of a flow chart indicating where and when transfer and discharge notices are to be sent to the Ombudsman program. And then meeting with the nursing home associations with regard to standardized transfer, discharge, and appeal forms. And we have a really good example from Nevada on this particular situation. So Jennifer, I'll let you talk about your example.
Okay, can everyone hear me?
Yes.
Okay, so I have reached out to the Nevada Healthcare Association, which both assisted living and nursing homes fall under that association, to find out if we can have a sit down with some administrators and to review the possibility of having a standardized transfer, discharge, and appeal form, and to obtain some buy-in from that. As I've expressed before, we have some major issues with the types of forms that are sent, missing information, much like many of you. And our quality assurance staff is assisting us in putting together some data on what the major concerns are. But I think one way that can possibly help alleviate some of that is a standardized form. And so I'm trying to set up some meetings with them to, again, get some buy-in and work towards getting an appeal form and standardized discharge form. We also had a great meeting after we spoke, Jamie, yesterday with our survey and search agency, and it was a great conversation. And whereas prior they stated, oh, go ahead and move forward with an appeal form and a standardized discharge form, we now are going to put together, they're reviewing it, and we're also looking at putting together a technical bulletin coming from both agencies and actually from the Department of Health and Human Services, not just our two agencies and not just the Ombudsman program. So we've made some great strides in the past month and a half or so, and having them understand the importance of this. And Stephanie Schneider, who's on the phone, is a former ombudsman and part of our quality assurance team now, and she provided some really great data to them, and I think that helped in yesterday's discussion and getting them on board of presenting this as a united front. And as Margaret mentioned, more than just a paper issue, these are people's lives, and there is harm there, whether it's emotional or not. There are issues with the transfer, discharge, and appeal information.
Thank you, Jennifer. I echo what you're saying in terms of utilizing the information that you're gathering and taking it and talking with whether it's the nursing home associations, the licensing and surveying agencies, or the facilities, but putting the statistics, putting a face to the statistics is what I'm trying to say. And so, yes, we can, kind of talk about the importance of the regulations, and that's very important, but when we show them, when we sit down face-to-face with these folks and talk to them about the implications that not following the regulations have on residents, that's where the realness comes into play, and hopefully people can start to see the very negative effect that some of these discharges have on individuals. So really great ideas and really great work that you're all providing, so thank you all. On to Project States training for administrative law judges and legal entities. A couple of examples are providing residents' rights trainings to ALJs and legal entities, and using former attorneys familiar with transfers and discharges to train attorneys new to the legal assistance provider. Always helpful to have somebody with experience teaching the new folks coming in. In terms of Project State's consumer education, we're looking at one particular state, Ohio, had a collaboration with the local homeless shelter network. Is anyone from Ohio on that could speak to this? Okay, no, we can table that one as well. That was a very interesting collaboration I'd like to be able to share with you all. And the next is a nursing home transfer and discharge brochure that Oklahoma had developed based on the information that the Resource Center had, but developed quite a nice, kind of a thick brochure that explains residents' rights throughout the transfer and discharge process. So we come to the point in our webinar where it's your turn to provide us some feedback with this discussion question. What training session with the topics of transfer and discharge or administrative hearings has your office provided or attended that was the most beneficial? And please include training to Ombudsman, licensing and surveying staff, ALJs, facility staff in your consideration. And remember, you'll have to unmute yourself in order to for us to hear you all.
Jamie, this is Mark. Can you hear us?
Yep, we sure can.
Perfect. Okay. So we've done 2 trainings. One with the administrative law judges. We did it a couple years ago. Just to acquaint them with what we do and how we would be available to represent residents. And I think, as a result of that and the work that Mary Ann's done, oftentimes they'll reach out to us now if a resident is appealing but does not have legal representation. So I think that was very successful. And I'm interested in hearing more about what Margaret's done in Pennsylvania with the bench book, because that sounds like that's probably a helpful guide. So I'm interested in what's in it. And then I don't know if I would call this overly successful, but Mary Ann and I, along with the representative from the health department, I think we mentioned this yesterday on the call, have provided training to all the district nursing homes on transfer discharge rights and appeal rights and all that. We still have plenty of problems, but we continue to reach out and make ourselves available to individual facilities, and Mary Ann has done that on a number of occasions. So I'd like to think it's successful, but we still see plenty of issues and errors with notices.
And I thank you, Mark. And part of that too is such a high staff turnover that you could be providing excellent training. Everyone learns what they're supposed to learn and gets off on the right track, and then you've got a whole new set of staff come in too. So, we're constantly dealing with some of that. Thank you.
Mm-hmm.
Thank you. Anyone else have a training session that you felt was most beneficial, whether you provided or attended a training?
Hey, Jamie, this is Amity. While everyone's thinking, I'm glad. Thanks, Margaret, for talking about the bench book that y'all are going to make, and Mark for mentioning it. You may remember I discussed that in Orlando about something I learned from the Aging in Law Conference. So that is still something that we would like to create, just a general version that states can adapt. But so hopefully we'll get that going in the future. So just wanted to put that out there before, or we can just steal Pennsylvania's and make it general for everyone else to copy. But I'm excited about that moving forward. So thanks.
Thank you. All right, any other examples? Okay, we will move along then. To using data to improve Ombudsman advocacy, training, and education and policy. As you all know, we have different forms of data collection and analysis. We have our data management systems, which include for some of you a web-based multi-state use such as PeerPlace or Ombuds Manager. Some of you have a state customized system that you're using, and so those are all NORS compliant, and only, unless you have a state customized system, and even that might be tricky getting that changed and updated, you're limited as to how you can set different filters and such to extract the information that you maybe really want to extract. So a lot of you have gone to additional internal tracking, particularly for this project where you have created spreadsheets, you've got charts, you've got reports based on the data that you're collecting so that you can kind of figure out and analyze the data and see what you're working on, see what the areas of difficulty are, and you're learning a ton about what's happening with the discharges and transfers in your state, I know. And then we have our NORS data that really can provide us some good information and to look to see what's happening in terms of transfer and discharge cases. So we're going to kind of break that down for you. and start with the project state's use of data management system. So again, I kind of talked about the challenges a little bit before. The different data systems have different reports and don't necessarily provide you the information that you need or that you want to be gathering or collecting. Some programs have had to be creative in order to track data pertaining to this project that maybe they didn't want to develop an internal tracking process, so they're trying to be creative with how they track within their web-based system. And it is difficult to track information and assistance by topic, whether you're working in, Ombuds Manager or Peer Place or what have you. And then training staff to accurately document can be quite a challenge in terms of cases versus consultations with, surrounding discharges and transfers, or, how do you count this or how do you count that? That can be a little bit challenging with the new information coming through. So what's happened is project states have developed an internal transfer discharge data points. And what I did was I took what all of you have sent to us, the information that you're all tracking, and put it all on one particular slide. So not one state is collecting all of this. So just kind of letting you know this is gathered piece by piece from what different states are gathering. Some are gathering the method of notifying the Ombudsman. So how it came in, was it an email, was it a fax? Certainly the date of notice. Some have added the date of admission, recognizing that that was an important data point to start to track. Certainly the resident's name, the representative's name, the reason for transfer. If it was non-payment, what the amount was. Some of you are tracking that. The name of the facility issuing the notice, the location to be transferred or discharged. Some note whether or not the notice is filled out properly or if it's missing information. That will note how much notice was given. So in some cases they were given a 30-day notice, but in some cases maybe it was a 2-day notice. Maybe it was a 10-day notice. Some of you are tracking the Ombudsman response time from the date that you received the notice. Some are tracking from the notices, was assistance requested, whether or not a case was open and what were the results of the case. And then some started to track specific concerns that they've noted during the project, such as homeless shelter discharges or discharges due to a PASAR issue. And so people have started off tracking in some areas and then ended up adding to the information and data that they're collecting based on what they were already seeing as trends. And some of you who are tracking the emergency transfer, here's some additional data points. So those monthly reports that you are hopefully getting from the facilities, you may be tracking whether or not the bed hold notice was given, the payer source of the individual, the acute care facility where the resident was transferred to, what's the date of the expected return, and tracking which facilities aren't sending monthly lists. I know some of you had already talked about having conversations with licensing and serving agencies saying, we're not getting these notices. So great job in the tracking piece of it. In terms of using NOR's data, this is just a graphic, it's not a real chart. There's a few things that you can look at. So if you go to the Resource Center website, let me see if I'll do this real quick here. So for cases, bear with me, not technical. That link will send you to this page, and so where I'm at is under the NORS data. The first one I'm going to talk about is a piece over here under NORS tables, and then another is under complaint tables. So you can take a look at, that's where I'm at. And so when you click on the complaint summary nursing facility total percentage, you're going to come up with this page over here on the right, and the two examples I'm going to show you in the next two slides have to do with this particular 3 CD nursing facility complaints by group and subgroup by state. And then under the residents' rights group, you'll see the nursing residents' rights complaint numbers by the subgroup. So I'm going to show you what those look like if you were to click on, here it won't work, but you'll actually click on that when you're on the website. And then when we get to slide 23, you'll see the complaint table for nursing facility complaints by complaint category and subcategory. And I think you'll see why that's going to be helpful to you as well. And so here's the first chart, the nursing facility complaints by group and subgroup by state. And if you go ahead and look, obviously where the big green arrow is, under C, admission, transfer, discharge, eviction, you'll see the state's total between 2012 and 2017. But then if you want to look at your individual state, you guys have done this, you know, you'll go ahead and look down and find your state to see the number of cases that have been opened using a C code, and then what percentage of that is your total percentages of cases closed. So that is one use that you can track your cases using NORS data. And then another is by the subgroup category. So under residents' rights, as you know, under C, admission, transfer, and discharge, there are several different subgroups that you can look at. So if you want to break it down even more, well, what were the cases specifically about? Was it a bed hold issue? Was it on the planning notice procedure? Was it, discrimination due to Medicaid status? Was it an appeal process that wasn't followed or that was absent? And so, again, you can go down and find your state to see where your number of cases are closed cases are in terms of each individual subgroup for transfers and discharges. And then finally, we have 2 discussion questions that we would like for you all to consider and provide feedback. The first is to please describe how you're analyzing and using the data collected from your tracking tools and or NORS data to influence Ombudsman case and systems advocacy, training and education, and or policy. And we have talked a little bit about that throughout when Margaret, for example, talked about taking her data and speaking with different entities to really bring it to life, to prove her point and such. So some of you are using your analysis of your data to look at what kind of training do we need to be providing our ombudsman, or what kind of education do facilities need in this area. So I'd like to give, about 5 minutes or so for you all to describe to us how you're analyzing and utilizing the data collected from your tools.
Jamie, it's Mark and Mary Ann.
Yes.
So as you know, we do a very in-depth analysis every summer to look at the data, and then so we put a report together and share that with the health department and also with each of the nursing facilities. So they can see here are the areas very specifically of things that we have found that obviously need an improvement in the notices in the process. The other thing I want to mention, and it goes back to the challenge of data, just kind of data collection and trying to be as accurate as possible. At one point, I looked at the data, and we were capturing under admission, transfer, and discharge, under that, whatever, C19, we were capturing issues where the resident was coming to us saying, I want to leave, but I'm not getting assistance. So what we found was we weren't using that code 128 or whatever it was, whatever it is that's designed specifically to, to capture that information. So when I initially saw that, I realized we weren't accurately capturing those that are involuntary compared to those that are somebody wants to get out and just for whatever reason, there's a barrier to them returning to the community. It made a difference in our numbers, which Mary Ann Fallingstad immediately identified.
Good. I'm sure. I have no doubt of that. Well, and that's an excellent point, Mark, especially when we're trying to track the problems, the cases. You might be receiving a discharge notice that is not improper, that the facility followed everything that they were supposed to do. It's filled out correctly, but maybe the problem is something else. Maybe the problem is financial exploitation. And so we're working on to resolve the financial exploitation piece, which will hopefully resolve the discharge notice, but it didn't necessarily mean that it was the facility doing something improperly. Could have been, but maybe not. But taking a look at, are we documenting accurately really what's happening and what our actions are? Are we really working a case? Have we just provided information and assistance, and what does that look like? So, yeah, that's one of the difficulties, I think, in getting everyone on board, not just within your individual states, but, with all of the states, so that when we look to the data to pull those numbers, that there really are an accurate depiction of what is happening out there with these particular residents. But I do like the idea, like you mentioned, of taking a sample of your sample months to really take an in-depth picture of what's happening and what's going on to develop your report and submit that out to everyone. And that's, I think, a really great thing.
Thank you.
Anyone else have anything on that? I know, Margaret, you used the data to talk with your state licensing and certification agency to really prove your points. And can you maybe speak to how surprised they were with what you were sharing?
We did. So Jay Rotz, who I think is also on this call, on some days he's receiving upwards of hundreds of notices from separate facilities, and we're really grateful to have him because he's logging each of them. And he has a spreadsheet. It's just a very simple Excel spreadsheet. But what he's doing is he's tracking them. He's also looking at each of them. So for those that are not consistent with those 6 reasons, or they're missing any kind of information, we send those out directly to the local ombudsman for advocacy if it's warranted. But when I met with my colleague over at Department of Health, and I showed her and looking at there are dozens upon dozens of homes, as I mentioned very briefly before, from whom we've never received anything. And that was a huge red light to her, because it meant that no one had been transferred out for anything even routine, which we get a lot of. And it also meant that they need to also look at how they can integrate review of the adherence to this policy or this regulation, how they can integrate that into their survey process. And I think they're still reworking that. We also, from time to time, get bad information from the facility saying that they've been instructed by the Department of Health to send us everything. Now, I've not found any evidence to support that, but to the extent that we can develop clear communication so that we can begin to hold folks accountable. But without that, it just seems like there are too many. And again, that starts with us having our own data intact with no loopholes, no exceptions, nothing missing. One of the things that I think has streamlined it for us, and I don't know if other states use it, but right now we accept those transfer discharge notices either by snail mail, by fax, or by email. We encourage it by email because I think that helps Jay process them a little more quickly. But one of the things that I would really like to do to ensure that there are no outs and there are no excuses is to begin to insist that we only get those by email. I think that will reduce the burden of paperwork as well. But here again, I think a lot of this is we're collecting good data, and we're able to, when we share it, it's compelling. But I'm still really, I'd like to focus more on how we can rework that messaging, because otherwise it's just more data, and it sounds to the surveyors like one more thing they need to check on, and I don't know that message has effectively gone out to that level yet, or that the regulatory entity is consistently looking for it. So there's still a lot of work to be done. So I'm glad that we're capturing it. I'm glad that we're tracking it, and it's been very useful to us where they've sent it to the wrong place, or they've only sent it to the local and not to us. But in terms of how we can speed that up and create some really good, effective communication, Pennsylvania is definitely still working on that.
I think we all are. So thank you, Margaret. So let's go to the next question as we have about 5 minutes left. In terms of data collection, what additional areas would you like to track but are not currently doing so, and what are the barriers?
I'll just jump in real quick with one more comment on that, Jamie. When we send it out for local response, that's kind of the end of the trail for us at this point. I'd like to begin to, in the upcoming year or so, to begin to track what happens when we send it for local. Are we going on wild goose chases, talking to residents who are aware of that they're being discharged and don't have any concerns, do not wish for us to advocate or to intervene on their behalf? And that's another missing link for us. And so I'd really like to build that piece out in the upcoming year or so.
Thank you. Anyone else?
Jamie, this is Mark and Mary Ann again. You know, we know the results, obviously, of those appeals that we handle, but we don't get any information with regards to residents whose family or who themselves are able to file an appeal and move through the process. So we're only seeing maybe a small percentage. And you know, the ones that we handle, Mary Ann is obviously very successful at. But those are because people have representation. And we're working with the facility to either get the notice rescinded, or, you know, if it seems like an appropriate notice or reason for discharge, but discharge planning hasn't happened, we will work with the facility to do the discharge planning. So, you know, we have a handle on that slice of the pie that we deal with directly. But what we don't know is how many people are filing appeals. I mean, out of the 418 that we looked at in this 2-month period over the summer, I don't know, Mary Ann, how many appeals do you think we handled where we actually were involved? 418, a dozen or so. Yeah. So that means there's a lot of notices that are going out there. And as I mentioned before, sometimes if a judge believes that the person is struggling or needs help, they will reach out to Mary Ann and ask her to step in if the resident wishes that. But I just wish we had a better handle on kind of the larger landscape of, okay, how many people are actually filing appeals and what's the result of those.
See, I'm kind of hearing that, being able to track every step of the way from the time that you receive the notice to if it does end up in hearing, what was the outcome of that hearing, regardless if ombudsmen were involved. I know additionally with, you know, in Oklahoma, they're really putting an emphasis on trying to track how many they were averted, how many before it went to a hearing. So they went and there was a notice given, Ombudsman acted, they were able to resolve the issue and then go on. And so they're trying to track that as well. So all excellent ideas in terms of different areas that we can be collecting information and then putting it to some really good use. We have just a couple minutes, and I would like to just open it up for any general questions or comments that any of you have, including anyone at the Resource Center. Whoops.
Hey, Jamie. I don't have any questions. I've had to join a little late, and then I've jumped off and on, but I've really enjoyed hearing all the work you're doing, and I don't have any questions at this time.
Thank you. It's the states are doing tremendous work. I'm so excited to be a part of this project. So just very quickly, the resources that we have at the Resource Center, we have a transfer discharge issue page. I believe you've hopefully all seen this, where we're going to be storing, and some of the resources that we talked about today are already on here, and those, if you guys could get us the resources, we'll go ahead and put those on here as well that you're utilizing. This is the private page for Ombudsman only for program management regarding nursing facility transfer discharge notices. We've got our Learning Collaborative landing page, again, so you can see what the project state examples of what we're all working on. You're all working on. And then the training and consumer education materials, including the fact sheet and additional information on transfers and discharges. So just a reminder, we did, with Alicia being gone now, we went ahead and put my email in, and if you have any policies or procedures, training, anything that you would like to communicate it to the Resource Center, go ahead, with regard to the project, go ahead and send it to me. And any requests for technical assistance, go ahead and reach out to me, and I will try to get to you as soon as I can. And sometimes it takes longer, not because we're ignoring you, but because it might sound like a simple question to you, but it might take a lot of time researching and really making sure that we're giving you the best possible answer that we can. So I appreciate your patience on that, but do continue to reach out for technical assistance, and we'll certainly do the best that we can. All right, well, that's all I have for today. I appreciate your participation and your time and attendance to this webinar, and hope that you were able to learn from each other's examples with today's webinar. And again, I appreciate all of you for participating in the project. Have a good day, everyone.
Thank you.
Thank you.